Greeting everyone. I am Dr. Deependra from Conceptual Orthopedic and I welcome you all in today's connect session with Professor Anil Dhal sir. And today sir is going to discuss a new short case on knee swelling. So I think this talk is again going to be very interesting and useful to all of you. So without any more delay, I welcome you sir on the board and I request you to start your discussion. And I request you all delegates please do participate in session as this is a interactive session. So now it's over to you, Professor Dhal sir.
Thank you, Dr. Deependra. So today's session is regarding a short case discussion, very common swelling of the knee joint. And you must have seen there are several talks, there are several sessions on the swelling itself, and you will also find swelling in the knee joint presenting in various forms. So this case is a little different from the ones which are already existing in the app, and my advice always has been that you should visit the app to look for the other cases of swelling of the knee. So since this is going to be an interactive session, I am sure you will all enjoy the session. So let us move on with the case itself. So as always, a very short history is required in a short case. So our patient happens to be an 18-year-old man who presented with swelling in the knee of barely 3 months duration. And this was the clinical picture of the patient when I undressed the patient, both the sides. So it is the right side, which is the right knee is the involved knee. The left one has been included in the photograph to allow you a comparison. So you can compare and Amurtha, what do you notice?
Sir,
where do you think is the swelling?
so the medial aspect of the knee is very much comparable, but there is appear to be a small swelling on the medial aspect of the knee. Yes, sir.
So this is the area which was pointed out by the patient, the area of the cursor. And you can see that in comparison to this area, definitely there is a fullness. Look at the parapatellar depression here on this side, and here it is more or less a fullness. In
Yes,
fact,
sir.
this entire area seems to be full. So this is the clinical picture, and this is a magnified view of the right knee, showing you this area seems to be a little abnormal. So what else would you like to know as far as the history is concerned after having a look at this swelling? What is the name of the other person? Manoj. Is it Manoj?
No, sir.
Can you-
Mayur Joshi, sir.
Mayur. Okay. Dr. Mayur,
Yes,
what
sir.
else would you like to know? Any
Sir,
other?
sir, we have to ask about any history of trauma.
Okay. So this patient does say that he fell down, and he was very categorical that he had a fall in the stairs and the knee joint came in contact with the floor. So this was the history. What else would you like to know?
Any history of, sir, fever or
Okay, so there was no history of any fever, loss of appetite, or loss of weight. All these three things were negative.
any instability while walking?
I would say any difficulty in walking. You should put it that way, because instability, the patient may not be able to appreciate the instability, but the easiest way is to ask him whether there is any difficulty in walking. Okay?
Yes, sir.
What else would you like to know? Amurta.
Sir, any pain?
Very good. So, is there any pain pain in association with the swelling, or is it a painless swelling?
Yes, sir.
What else? What else would you like to know?
Sir,
when
any
we-
yes, sir. Yes, sir.
Yeah, please.
Yes, sir. Sir, any restriction of movements, like any activities of daily living that is hampered?
Okay. What else?
Uh, mm,
So, if you look at what I told you, that if you ask the patient, because it is the knee joint is one of the prime functions of the knee joint is to provide comfortable mobility to the patient. So, if you ask him, is there any problem in walking? So, he will come out with the 2 points which were raised by Amurta. Is there any pain? So if there is a pain, then on weight bearing, the pain probably would be more accentuated. Then you also made a point that is there any restriction of movement? Restriction of movement of the knee joint. So again, it will be reflected. It may be reflected in when you ask him any difficulty in the movement. But one point which has been missed is we have been talking about it in every swelling. What is the progression, rate of progression? Is it rapidly increasing in size, or is it not increasing in size at all? Is there a waxing and waning phenomenon that sometimes it becomes less, or other times it appears to be more? So evolution of the swelling is a very important point which must be asked in all these cases. So let us see. We have already listed association with pain, and our patient was having a lot of pain, so much so that he said that he is only able to walk if he takes support of 2 persons for the last 6 weeks. The swelling has been there for 3 months, so for the first 6 weeks he was able to walk independently, but now the pain has increased to such an extent that he needs the support of 2 people if he wants to go to the bathroom. The swelling, he was not able to tell us whether it is rapidly increasing or what, but he said that it is definitely increasing in size. And since the swelling was there only for 3 months, he said that he is not able to tell us the rate of progression. Another point which needs to be talked about is, are there any other similar swellings elsewhere in the body? So there were none in this case. And we already have told you that there was no loss of appetite, or loss of weight or fever. So how do you plan to sort of inspection, what all would you like to see? Mayur, what all would you like to comment upon in the stage of look or inspection?
Sir, sir, first swelling,
Okay,
mild swelling present over the middle aspect of sir knee, right knee.
okay.
Sir, then
Let us first look at the
okay.
points, then I will show you the picture again, and then you can tell us what all is there in this patient. Okay.
Sir, swelling, position of patella, sir.
Mm-hmm. I think first and foremost is location of the swelling. Instead of position of the patella, it is the swelling. We have to tell where exactly is the swelling located.
Yes, sir.
What is the number of swelling? Is it a solitary swelling, or does it appear to be 2 or 3 swellings? Shape of the swelling. All these points need to be talked about. Amurtha, would you like to add something?
Sir, the swelling in detail, sir, site, size, shape, location, sir, number, sir, overlying condition of the skin, any venous prominence, any visible scar or old scar or sinus,
Okay,
or any.
all right.
Yes, sir.
So overlying skin covers all of these points, which are you see if there is a scar, if there is a sinus, it will be shown on the overlying skin.
Yes, sir.
Okay, so this is the picture which we were showing earlier, and I will show you the isolated knee picture. And now you can tell us, Amurtha, can you tell us what you find on inspection?
So in inspection, the swelling is in the medial aspect of the right knee.
Okay.
So the size, it may be, sir,
approximate size.
Yes, sir. Approximate size appears to be a 1 × 1 centimeters. I can't actually.
1 to 1 centimeter is too small.
Yes, sir.
I think